Hi, my name's Elaine, and I've had Lyme disease since 2002. I went to many doctors in my area, and no one at the time could help me. I ended up going to an out-of-state doctor and was put on IV therapy. I did both oral and IV drugs for Lyme disease, and it was a very successful treatment program. During the time I was on the therapy, I decided I would write a brochure for my area to try to spread the word about Lyme disease, what it was, some of the symptoms, and I offered it on YouTube several months ago and got a fairly decent response. A lot of people wanted a copy of the brochure, so I decided to do a video. The brochure talks about Lyme disease as far as what Lyme disease is. There's a paragraph about, that describes what it is. Of course, it's a bacterial infection, and it tells you, that the deer tick is one of the carriers of Lyme disease. Of course, I don't believe that it's the only carrier. There's many different species of ticks that can give you Lyme disease. Also, we do think that most people I've talked to in the Lyme community feel like it's also being transmitted by other vectors or other means. So I did a paragraph on that. There's also a paragraph about co-infections. Me personally, even when I was treated for Lyme disease, I had some symptoms that wouldn't clear up. Extensive blood work was done, and they found that I did have babesiosis, and of course when that problem was addressed, several symptoms that wouldn't go away from just the initial Lyme disease treatment disappeared because they did need a different treatment. Also, there's a paragraph on testing. As we all know, less than 50% of people that actually have Lyme disease test positive for it, which is unfortunate. I've included 3 pictures of rashes. Not all are bullseye. You don't have to have the bullseye rash to have Lyme disease. Some people I've spoken to over the years don't even notice a rash, don't even remember a rash. Also, make sure if you're bit and you develop a rash, you take a picture of that rash. That's always good to have for the doctor. I've included symptoms on the brochure. Of course, if anybody knows of any different symptoms, I will be happy to add them to the next revision of the brochure. So if you have other symptoms that I didn't list, please send me a message, let me know what they are. I have a paragraph about prevention, a short paragraph on prevention, a paragraph on how to remove the tick, and most importantly, I've listed 3 tick testing labs with their phone numbers. If you can remove the tick, put it in a small airtight container with a moist cotton ball. You can call one of these numbers and they will give you fee information. You're looking at $35 to $65 roughly, and they will give you shipment information, and they will test that tick for you. Treatment options. Of course, most of this paragraph deals with antibiotic treatment, as that's the road I traveled. That's what worked for me. But at the end, I do list some other treatment options, some other forms of treatment. Also, what is a Herxheimer reaction? I believe these are so important, and they're so very important to Lyme literate physicians. In the paragraph it says that if you don't have Herxheimer reactions, it really makes them question whether or not you truly have Lyme disease. Lyme disease being the great imitator. I don't think that's any secret to anybody that it can mimic or imitate just about any disease that's out there. And then finally, at the end of the brochure, I've listed a fair amount of resource information. So, there are a lot of organization websites on here, and also, some sources, different sources for information on Lyme disease. And just my opinion, on a personal note, there is a film documentary out there, Under Our Skin. It is an absolutely wonderful communication tool for those of you that have family members and friends and they just don't understand what you're going through. This film is just remarkable. Several different Lyme patients, they have several different varying symptoms, and it shows a little bit about what's going on with the battle with the doctors and the mainstream medical and insurance companies, and it's just a wonderful film, and it should really help your loved ones understand. And if you are interested in a brochure, send me a message with your email address. It's absolutely free. I'll be happy to send you a copy. And everybody out there is on my prayer list, and God bless.